Okay, we're continuing now with Prevent and Reverse Kidney Disease by me, Pete Rogers. This is something like part 14 or something. Okay, we just did Gregory Sloop. Before that, William Roberts, two atherosclerosis experts. Now we're going to do Roy Swank. We're also going to do Nathan Pritikin. So Roy Swank, he's an MD PhD from Harvard, and he has the best results of any doctor in the world for treatment of multiple sclerosis. The reason that's relevant to the kidneys is because he did a lot of studying of blood flow, and he found when people eat a high-fat diet, in his experience, he especially emphasized what he discovered about saturated fat. It would stick the red blood cells together, overcoming the zeta potential, the negative charge on the red blood cells, with the positively charged chylomicrons. That's the initial way that fat is transported in the blood. And that would make the blood thick like a milkshake instead of thin like water, and that would drive up pressure. But it also, he would check the oxygen level in the tissue next to the blood vessel, and he found, like in a hamster brain, he would drop the oxygen delivery by about as much as 30%. Peter Quo had found in the 1950s he would drop oxygen delivery about 15 to 20% after a high-fat meal. So there might be a confounding variable. I think they were sometimes given high fat and high sodium. You can imagine that happening simultaneously, like when somebody also feeds like pizza. You know, it's high fat, but it's also high sodium, vasoconstrictor. So anyways, it's a significant amount, and Roy Swank felt that that was damaging the blood-brain barrier. Okay, so the relevance of all this is, what is atherosclerosis? Atherosclerosis is a blood clot. What causes atherosclerosis? High-fat diets, high-sodium diets, hypertension, diabetes. So the high-fat diet is contributing to leaky gut, which causes autoimmune disease, which is bad for the kidneys. It's contributing to hypertension. It's contributing to increased diabetes. Insulin resistance main causes is fat, especially saturated fat. So all of this stuff is going to worsen kidney function. Okay, here's a little bit more of Roy Swank's work. He followed MS patients for 50 years. He had published at least at like about 32 years, and 95% of early diagnosis MS patients were still intact for their activities of daily living, their ADLs. So here's a paper by Swank, Intravascular Aggregation of Blood Elements Associated with Alimentary Lipemia, eating a high-fat meal. Okay, fat made thick blood, and it could injure the blood-brain barrier. So he said, when severe enough, this could injure the blood-brain barrier. Okay, and it would take like 9 to 12 hours, which is basically about the whole day, for it to go away. So, yeah, and it's a good video. If you go to Dr. McDougall's YouTube channel, it's called Blood Sludge Before and After Eating a High-Fat Meal. It's only 50 seconds. I'll try to remember to put the link in the description below. It's good. Like I said, you remember that the rest of your life. Okay, I got videos about Swank, and Dr. McDougall has some of his lectures on his YouTube channel as well. Okay, this next article here is about dietary triglycerides' effect on the rheological, the physical properties of human red blood cells and blood flow. A significant increase in rouleau formation was observed in samples with high postprandial, that means postprandial means after eating, triglyceride levels. Plasma triglyceride levels correlate significantly with rouleau formation rates. So we just saw chylomicrons do it, and now here we're seeing triglycerides do it, and we know from Dr. Sloop's work that LDL cholesterol does it. So all of these types of fat cause blood sludge, cause thickening of the blood. Thickening of the blood can also be phrased as increased blood viscosity. And these things are all associated with obesity, hypertension, and diabetes, the gateway diseases of Western civilization that lead to atherosclerosis. What is atherosclerosis? A blood clot. So you can see how this is all going together. And what damages the kidney? Most common cause is diabetes and hypertension. So you plug up the arteries in the kidney, you damage its vessels with diabetes and hypertension. You also damage the glomeruli, the filtration units of the kidney, and then your kidney's not going to work so well. And in so doing, if you can reverse these things and stop these things from progressing, then you can slow down your rate of kidney failure. All this stuff is related. Okay, so the next person we're going to talk about is Nathan Pritikin. Nathan Pritikin in the 1980s did an extensive review of the scientific literature on dietary fat and cardiovascular disease, and he concluded fat is bad, that it was impossible, essentially impossible, to be too low in dietary fat with any naturally chosen plant-based diet. Dr. McDougall also agreed. Dr. McDougall said, fat is the biggest toxin in the Western diet. Fat makes you fat. The fat you eat is the fat you wear. Okay? So here's, one of Nathan Pritikin's books, The Man Who Healed His Heart. That's the one written by his wife. He died in the 1980s. Here's another one of his books, The Pritikin Program for diet and exercise. And Pritikin writes very clear. He's very logical. He also came to the conclusion it's impossible with any naturally chosen diet to be too low in protein. You just can't get it down that low. So it's a non-issue worrying about getting your protein. Okay. You can go to Dr. McDougall's website, drmcdougall.com, and see Nathan Pritikin's legacy book. It's great. It's a masterpiece. And again, he emphasizes what he called lipotoxemia, the harmful side effects to health from eating high-fat diets. Okay? All right, so those are some key points there that, in the opinion of Pritikin, McDougall, you can't be too low in fat, you can't be too low in protein. And the relevance is, I get all of these people on the internet always asking me, what about my good fats? What if my protein's too low? I've never seen it. I've been a doctor, I don't know, about 35 years. I've never once seen a patient too low in fat or too low in protein. That's a non-issue. Okay, what really matters for these kidney failure patients is reducing that dietary protein, getting rid of all the animal foods to get their health in control to protect their kidneys. So, hope you found that helpful.